It was so crooked, it was just so crooked. I couldn't even eat a proper way, I couldn't swallow correctly.
We kind of got a bit put off because they said they're going to have to take out a lot of teeth.
Generally, you normally have to have extractions for braces.
The forces quite often are too great.
People I know have them and they cut their gums on them.
They're at the adolescence age, where appearance is quite important.
The incorrect oral habits like mouth breathing and incorrect swallowing are limiting the facial development and also crowding the teeth.
Did you know 3 out of 4 children have crowded teeth and incorrectly developing jaws? These problems can be evident to many parents in their children from as young as 3 to 5 years of age.
She was about 3 or 4 and her teeth were very crooked, and then we went to the dentist and they said by grade 5 she needs braces.
So that's 7 years that she would have had to wait for braces.
A lot of children, and since I've seen their teeth nice and straight, I was like thinking, okay, I'm sure I really want to do this.
Roy had a very overcrowded mouth and we kind of got a bit put off because they said they're going to have to take out a lot of teeth.
I've been in the dental industry for 20 odd years, have seen kids come and go regarding braces and things like that. My girls were getting to the stage that they needed some treatment of some sort, had seen what braces can do, didn't really want to go down the track of extractions and braces.
The professional advice is to wait until all permanent teeth are present and to treat with braces and extractions. Most parents accept this advice and wait till their child is 12 to 14 years old to have braces. However, as many parents have experienced, when the braces are removed, the teeth usually crowd up again. Did you have braces when you were a child?
As a child, I had a couple of extractions, adult teeth, and I wore a little orthodontic appliance perhaps for a year, just to maybe just help the straightening a little bit, but that was left after that, unfortunately.
And did you notice any problems?
Just a slight relapse, just for the fact that I didn't continue treatment.
What are the potential risks involved with traditional orthodontic treatment?
Generally, you normally have to have extractions for braces, and also with the brackets being on the teeth, you can get sort of marking and things like that, and decay as well. A lot of kids tend to not clean their teeth as well with braces.
Well, the traditional way of doing orthodontics generally involves using braces, using brackets on all the teeth, and fitting a wire and straightening the teeth. Now, there's always going to be a place for that traditional approach. It's still the most efficient way we have of mechanically straightening the teeth. Now, the problems associated with braces is that the forces quite often are too great, and that can result in what we call root resorption. And that means a wearing away of the end of the root that's attached to the bone. And it can also cause other problems like recession of the gums around the teeth and little what we call white spot lesions, which is demineralized tooth where the brackets are.
People I know have them and they cut their gums on them and just can't eat chewing gum and apples and stuff like that. So.
MRC over the past 2 decades have proven why a lot of children develop crowded teeth. MRC discovered that when a child has early signs of crowded teeth, poor facial development also occurs. Bad oral habits such as swallowing incorrectly and breathing through the mouth are the major cause. The forces of the tongue, cheeks and lips combined with bad oral habits can greatly affect the positioning of the teeth and facial development. A normal upper jaw should look like this. It forms that way because the tongue sits in the upper jaw. But if you breathe through the mouth, the tongue drops down, the upper jaw becomes narrowed and the teeth become crowded. If you swallow incorrectly with lots of movement in the lower lip, then the lower teeth are pushed back, which causes crowding. The trainer system corrects this so your teeth, jaws and face can develop correctly. Look at this child to see what happens when we change from the wrong tongue position to the correct tongue position. Straight away, the face looks better. MRC Clinics has a different approach to orthodontic treatment based on extensive research. The fully designed state-of-the-art computer appliances by MRC assist the correction of bad oral habits in the growing child. These appliances improve dental and facial development and correct orthodontic problems earlier, often without the need for braces.
Caitlin, give us a big smile. Wow, look at the difference. Are they your teeth?
Yes.
Wow, and how long ago were they?
10 months ago.
10 months ago. So in 10 months you've gone from that to that. Has it been a lot of hard work?
No.
Tell me about MRC clinics and how it differs from traditional orthodontic practices.
Okay, well, the main point of difference is that we don't use braces, we use appliances. Secondly, we intervene early, so we treat the kids while they're quite young rather than at a later age, which is what the traditional approach does.
To give you a little more information on how this all works, we have the founder of Myofunctional Research, Dr. Chris Farrell.
It differs from traditional methods in a few ways, but mainly traditional orthodontics is directed towards moving teeth, and it does that very effectively. We use a completely different principle, and that is we change the oral environment. We get rid of the bad oral habits that are causing the malocclusion in the first place, and we align the teeth that way. But not only do we align the teeth, we also get better jaw development, and also that amounts to a better face. You just close together. You can still just, your posture's forward, but you can still probably drop down. I like to show parents what's happening to their child's face. The incorrect oral habits like mouth breathing and incorrect swallowing are limiting the facial development and also creating the teeth. So we need to correct these myofunctional habits. By correcting these myofunctional habits, we know we're going to get a better face and improved dental alignment. So it's important when parents understand that we're not really trying to align the teeth, we're taking away some bad habits which are restricting correct dental and facial development of their child.
What do you do with the MRC trainer and how often do you use it?
Well, basically you use it overnight and 1 hour in the day.
Is it hard to wear it at night time?
No.
And what are you doing when you do it for an hour a day?
Mostly watching TV.
So it's that easy. And show us what it looks like. And smile. What were the differences you noticed between MRC and other orthodontic practices?
Obviously, it interested me for the fact that no extractions were necessary, and to go ahead and wear an appliance that was a little bit less invasive.
Because I think braces is much more difficult than
This was much easier for you, wasn't it?
Much more easier, yeah.
And how old are you?
I'm only 10.
So you're able to start at quite a young age?
Yeah.
Yes. They're at the adolescence age, where appearance is quite important, and they've had to do it pretty much pain-free and stress-free.
There was such a high demand from parents and patients for earlier treatment and treatment without braces. So MRC Clinics really is devoted to this form of treatment. Earlier treatment, treatment without braces, and very much directed towards better facial development.
What are the changes you've noticed?
Oh, just even in her confidence to start off with. Her teeth are a lot straighter. She's sleeping better with the breathing techniques that are correct, and yeah.
Profile definitely has changed, yeah, definitely. She seems to be a little bit more positive about things.
My teeth have completely changed. They're straighter and they look much nicer.
And what about over the whole 8 months? What have you noticed from when you first started using it to now? What are the main differences you've noticed?
Well, the main differences I noticed was that because for the first month it was so crooked, it was just so crooked, I couldn't even eat a proper way, I couldn't swallow correctly. Mm-hmm. But because now I can do all these things, it's great.
Yeah, his mouth is actually, like his whole jaw's filled out. He had a big crease coming in there.
My nose is kind of opened up a bit because people used to like tease me because I had a squashed nose. And it's changed now, and you look back in old photos and you see your whole face basically, so it's all changed.
So you're a big fan because it's changed the appearance of your whole face, really.
There are two main things that affect treatment that in fact determine the course of treatment, and that's compliance, number one, and number two, it's the child's ability to change. So we have to make sure the child is motivated and is ready to be able to wear their appliances every day, because successive treatment depends on those two things.
Well, traditional braces align teeth very effectively, but the underlying causes of myofunctional habits, the mouth breathing, incorrect swallowing, have been more difficult to correct. It required an experienced practitioner, and these exercises were very time consuming. In addition to that, it wasn't very rewarding because they didn't work very well. What we've done first of all is develop appliances that do a very similar thing, but in addition we've taken those myofunctional exercises, modernised them and put them on an interactive DVD so the children really understand that they have to correct their own habits. This has been quite a breakthrough in terms of being able to treat these habits more effectively, earlier, and we can treat the whole family simultaneously.
Hi.
Here for all the tailors.
Okay, just take a seat. So you were able to get all the children treated at exactly the same time?
Yes. Yep.
Took them all in together and
Yep.
starting from as young as what? 2 years, 1 year old was
She was only one, yeah.
when she started. Wow.
We'll get you in the chair, Roy. Take a seat. You guys just want to take a seat. Roy, how have you been going with your trainer? Yeah, right. Yeah, right.
How do you get a little squirmy 3-year-old to wear an appliance in her mouth?
At night, I just give it to her and she puts it in. She never had a dummy as a baby, so that kind of was a new thing for her, so it was good. You liked putting it in, didn't you? Did you like wearing your mouthpiece?
Yeah.
Okay, so it shouldn't actually be touching our front teeth. It should be just a little bit back from there, okay?
So what measures does MRC Clinics have in place if a child doesn't want to comply with the treatment?
Okay, so MRC Clinics now has quite a few new educational programs, activities and tools that we're now using. Each child goes through them. It's all catered towards making sure that their compliance levels are all up to scratch and that we're able to get a better result at the end of treatment.
MRC Clinics is a pretty fun way to get your teeth and jaws straight. Caitlin, what happens in here?
Basically, they come out and teach you how to do all the activities.
And what are those activities?
Tongue on the spot.
Show me that one. And what else?
And breathing.
And what do you have to do with the swallowing activity?
Basically, you have to try and not move your jaw.
Okay, so you just go.
The whole MRC Clinics concept is geared towards fostering compliance. From the decor of the rooms, that's very child friendly, to the website that we have where the kids can log into and access videos of the activities they need to do every day. And we check with them each time they come in, which is about every month for the first year. We see how they're going with their activities. So everything is geared towards fostering compliance, but in the end, it is up to them.
What's your favourite thing about coming into the MRC Clinics?
It's nice and fun.
Yeah, it's nice and fun, colourful, bright, you get to do all the activities. It's kind of a fun way to get your teeth straightened, isn't it?
What we're finding now in the practice is the effectiveness of the treatment is much better than it was before. First of all, the appliance designs are better, the communication with the children is better, and thirdly, with the interactive DVDs, the children are taking on the responsibility of correcting their own habits. And we're finding within months we're getting changes that took us maybe years to do before.
Is the MRC trainer ever hard to use?
No, they're not usually hard to use. It was a bit hard at the beginning when you were getting used to it.
How long did it take?
For me it was about 2 weeks. Just I woke up and my brace of things like on my bed and I'm like, ooh. Yeah, but after that it was really easy.
Are there any other negatives associated with the treatment?
Other factors such as age, the patient being too old.
And how old is too old?
Well, we do want to treat the children between the ages of 5 to 15 while they're still developing and their bone development and growth is still happening. We don't want to wait until it's all come to a halt. It's so much more easier to get things changing while they're still young and growing.
So the earlier the better, really?
That's right.
Well, there's no known side effects per se, but sometimes, very rarely, we do see some kids with a little bit of irritation around their gums from the appliance rubbing on their gums, but that's easy to fix by just trimming the appliance down.
How does it compare to traditional orthodontic treatment in terms of expense?
So we are looking at treating the child a lot younger. The younger they are, the cheaper it is, as we don't have to do as much more treatment as you would when you're waiting to go with the more traditional approach, which is with braces. So yes, we're doing more of a preventative form of treatment, so generally the expenses are a lot lower.
I look at her day by day and I go, Lily, my goodness, within 8 months you have really improved, haven't you, Lily?
Yeah.
Face has changed, all my jaws pulled out and everything. And it's kind of really, it's fun, like it's not painful. It's not as painful as
Then you get to do the exercises and it's a fun way to do it.
Well, we needed to educate children and their parents, but more importantly now, the demand for MRC clinics has risen so much that we need to focus our attention on also educating doctors that we can do it this way for most patients and do the treatment, the orthodontic treatment, much more effectively than ever before.
Well, I'm not only seeing just individual professionals adopting this treatment method, I'm seeing a global trend moving towards early intervention and the MRC clinic's way in particular. This younger generation of dentists like me and oral health professionals are just moving towards where the evidence is taking us.
We started 20 years ago saying this is the way to do orthodontic treatment, by correcting habits as well as aligning the teeth. Now it's good to say that this appliance system has been used in 100 countries throughout the world. We think over the next 20 years it will become the standard orthodontic treatment, treating earlier, treating myofunctional habits first, and orthodontic treatment will become simpler and more effective.
It's not just straightening your teeth, it's correcting your habits for the future.